Welcome back to our podcast. We just finished talking to the founders of the Act Now Foundation. They were talking about November being National Caregivers Month, but it is also Alzheimer Awareness Month, which is why we are talking to a principal investigator. We're joined now by Dr. Raminder Parihar. She is with the Cognitive Research Center of New Jersey. Welcome, Dr. Parihar, to ABC7NY and this special podcast. Tell us why, what you do and why it is so important at this time of the year and all throughout the year for this disease that affects so many people to be aware of clinical trials and kind of the help that you can give and the hope that you can give to trying to find a cure.
Well, thank you for that kind introduction. And thank you for having me to talk about something that's very, very important. And I believe that a lot of patients need to be made aware of the different treatments that have become available. This condition initially had been felt to be something that once you have the diagnosis, there's nothing that can be done, but this has been changing over the last 3 years. We've now have 2 medications that are FDA approved for treatment of Alzheimer's disease, really addressing the pathology behind what's causing it. And there's just continuous studies being done that are looking into those particular pathologies, but also looking at other mechanisms of trying to slow the progression of the condition.
Walk us through what it's like for someone to come into a clinical trial and why it's important to continue the research. So first of all, you have somebody diagnosed in your family by your primary care doctor, and then you want to have them take part in a clinical trial because, of course, you're desperate for answers and you're desperate for a cure. So what does that look like for the patient and the caregiver, Dr. Parihar?
So coming into our study center, specifically with the concern that you have a family member that has Alzheimer's disease and wanting to know whether that's something that you may develop in the future. Being part of our center, you can undergo a free memory screen, but there's also some newer treatments that are being made available that we are currently studying. These aren't medications that have been approved, but we know that in Alzheimer's disease that before the patients actually exhibit symptoms of memory loss, that the pathology is also already occurring in their brain at an earlier state, an earlier time point. So a patient or a family member who has a first-degree relative that has Alzheimer's disease, they should be coming in and seeing if they can participate in some of our preclinical trials that we are currently conducting that are related to looking for patients who potentially could develop Alzheimer's disease and seeing if we can treat them to help prevent them from even developing the symptoms.
And I know because I participated in screening for one of the clinical trials that you come in, you have an office in Springfield and then in Ridgewood, and then you get there's a blood test and then a questionnaire, and then if you get accepted into a study, you have to have a partner in that study that can kind of help log things for the doctor.
Right.
Some people get a placebo, some people don't, but that's
right.
That's important. Why should you, if you're going to be considered for one of these things, a clinical trial, why is it important to have a kind of a study partner?
So the point of having a study partner is one of the cognitive measures that we're looking at. It's not just asking the patient themselves if they have problems with their memory or with their concentration, the attention. The caregiver or a study partner who is familiar with the patient and is able to, it speaks to them at least about 10 hours in a week, is able to figure out if somebody's having issues, maintaining a conversation, having word finding difficulties. And we take that piece also when conducting some of these cognitive studies. And that can help give us a particular score on one of the rating scales to know if there's progression versus stability versus no memory impairment at all.
Why is it important to you and to the researchers, you're a principal investigator, to get more people into clinical trials when you are dealing with drugs that could hopefully end Alzheimer's?
So it's really important because if we don't conduct these research studies, these medications are not going to get approved. So it's really important for patients to participate in these studies. And even if they get placebo, there's always a chance most of these studies have extension periods where they will get the study drug. Even if they were on it before or if they were on placebo before, they will get the study drug during the extension periods. So it's really important to be part of these studies so that we can continue to move forward and learn more about how we can help these patients and how we can work towards finding that cure.
And as that provides so much hope, you, aside from medication, your team and you are very much involved in educating families and caregivers and people that are suffering with this disease on how you can help yourself with diet, with environment, with exercise. Just run us through, for people that might be listening and watching, Doctor, what sorts of things are you finding that can really help mitigate some of the symptoms of Alzheimer's? And a lot has to do, first of all, let's start with what you're eating. There's a whole brain health component of the study and the research that you do.
Right. Yes. No, absolutely. So one of the things that also is like beneficial when you're being a part of these studies is you're constantly meeting with the study doctor, no matter what. And during our study visits, one of the things that I'm always promoting is how you can contribute to your brain health. And brain health includes sleeping, 6 to 7 hours of good sleep during the nights without interruptions. Diet is very, very important. The Mediterranean diet has been shown to be the most effective when it comes to improving brain health. So that means less carbohydrates, more fruits, veggies, olive oil, and drinking lots and lots of water. It's also very, very important for exercise, at least 20 to 30 minutes, 4 to 5 times a week if possible. And exercise meaning not like lifting weights, we're talking about aerobic exercise, just to get the blood pumping, like get some of that oxygen to the brain. And then the last thing that I always do indicate to my patients as being very, very important is keeping yourself mentally active. So if you think about the brain as a muscle, if you don't use it, you lose it, right? So if you're doing the same thing every day, your brain sort of goes into a sleep mode where it's not really doing any active thinking. So you need to challenge your brain in order to remind it, like, I still need you. I still need you to be able to navigate what I need to do.
So wake up your brain once in a while. How important is socialization?
Very, very important. Socialization it's part of the reason is because of the emotional aspect. There's the emotional system that does play a role of increasing dopamine, and that can improve happiness and improve concentration, attention. So that plays a huge role in helping to at least mitigate some of the symptoms from progressing further.
I want to wrap up with the research that you've done and the hope of these new medications. And we did a story, and which hopefully we'll be able to play as part of this podcast, on some of the medications that show promise, and promise that we haven't seen in 30 years. Talk to us about the what's on the forefront of the medications and how close you think we are to actually finding a cure for Alzheimer's.
So I think it's going to be a combination. So right now, the therapies that we have that have been FDA approved are specifically geared towards working to remove amyloid from the brain, amyloid being one of the proteins that is abnormally accumulating in the brain. There's another protein, a tau protein, which those two medications are not really addressing. And that usually occurs later on as like the condition progresses. So some of the newer medications that we're currently in the process of researching or doing trials with are addressing that specific protein, the tau protein. And then, like I said, we know now that Alzheimer's, the pathology starts earlier before symptom onset. So trying to get to those patients in that preclinical stage, and we have already started recruiting for a study that's looking at patients in their preclinical stages. And then also we will be starting another one early next year, again, looking at preclinical patients and treating them early on to see if we can prevent symptom onset. So
like a lot of things, early diagnosis is so important. Are you seeing improvements with the new medication?
So you mean the ones that have been FDA approved?
Yes.
Yes. Those medications have at least been able to improve the symptoms and also prevented further progression.
Preventing symptoms and preventing further progression, that's huge. That's everything.
Yeah, absolutely. Absolutely.
Are you confident that we would find a cure in our lifetime for Alzheimer's?
So I'm not sure what
like eradicate
how old you are
eradicate it
yes,
in the next 30, 40 years?
Yes. I think with the combination. So it may not be the one medication that is the key. It may be a combination of medications because there's also an inflammatory aspect to the pathology that also should be addressed, which is not really being addressed with these medications. So it may be a combination of things together that will help address this better.
I think that for so many families that are suffering, a combo platter it gives that kind of hope, whatever it may be, because it's been so hopeless in the past. Thank you so much for joining us on this podcast, Dr. Raminder Parihar. We are so grateful for the work that you are doing at the Cognitive Research Center of New Jersey. And if anyone would like more information on getting yourself or your loved one into a clinical trial, we put that information on our website, ABC7NY. Thanks again for being here.
Thank you for having me.
You're welcome.